Hi, it's Mrs. B again. Yes, you are definitely reading this correctly. The title of this PowerPoint is What's Your Poo Telling You? No, seriously, there is a story to tell here. You know I wouldn't lie to you. Brought to you with excerpts from a book written by Dr. Anish Sheth, MD. He's also known as Dr. Stool. He is pretty renowned, and he actually is a GI specialist, and he is responsible for treating and diagnosing many patients having stories to tell with the GI tract and system. I guess this is going to be Mrs. B's version of a spin-off from Your Urine Tells a Story, or What Does Your Urine Say to You? Okay, so this book, and it'll be available for you to read, Poo History and Facts. Okay, even though everyone poos, societal norms dictate that issues pertaining to stool be kept private. If someone's having an issue with their bowel movements, it's not something that people are just readily explaining, talking about, sharing with others. There's been like an ooh, we don't talk about our bowel movements. We just want to go secretly and not pay attention to it. But things that you see in your bowel movements themselves are very important, and you get used to a routine. You get used to foods that you eat, things that affect your bowel and the amount of times that you produce stool a day. And like a snowflake, each poo is unique and it tells a story. Poo is diverse and comes in a variety of shapes, sizes, colors, and smells, and that delivers a story. These poo stories can assist a physician in diagnosing numerous disorders, and that in fact is what Dr. Stool counts on. The average weight of a poo a person passes is usually about a pound in weight. That's kind of unbelievable, a whole pound. King Louis XIV of France often held regular meetings while sitting on his toilet, which he referred to as the throne. He was often known for relieving himself in front of both royalty and staff. There was no taboo back then. They said this guy actually reigned for like 72, 74 years or something, and he was a very successful ruler. I guess he was very relaxed, had a good self-esteem, and he had no inhibitions about relieving himself or having bowel movements. Now, this next slide, we're going to talk about the colors and types of poo. So stool comes in many different shades. When I was telling you that when you evaluate what stool looks like, just like you're evaluating what urine looks like, it's going to tell you of numerous things that possibly could be wrong with it, okay? So you have shades of poop. You have the normal brown. This poop is normal. It's naturally brown due to the bile produced in your liver. And most of us have a nice formed brown stool when we pass it. Sometimes you look in the toilet and you go, oh my goodness, that's like bright green. Green stool, it's possible that the food may be moving through your large intestine so fast that it produces that greenish color, or that you could have eaten lots of green veggies or even green food coloring. Yellow can indicate that maybe there's like some greasiness or fat in the stool. It's also foul smelling. Yellow poop comes from excess fat, which could be due to a malabsorption disorder like celiac disease. Okay, babies sometimes have that really seedy looking yellow stool, and that's from like being breastfed. Black stool, this could mean that you're bleeding internally due to an ulcer or cancer. Some cancers, the tumors that grow inside the intestinal tract can actually break off little shreds of the intestine, and you can actually have some stool that has blood or looks like darkness, or tarry stools. Some vitamins that contain iron supplements, that makes your urine very dark and it could appear black. Bismuth subsalate could also cause black poop, and that's like, Pepto-Bismol or something like that nature medications. And keep an eye out of it if it's sticky. See a doctor if you're worried. Now, when you have a black stool, yes, that could be announcing the fact that there's blood in the stool, but that's telling you that there's old blood. Old blood is very dark and almost black in nature. So if there was some type of a bleed in the GI tract, black stool would indicate that it is in the upper part of the GI tract versus the lower, okay? Light colored, white or clay colored stool If it's not what you're normally seeing, it could mean that you have an obstruction, especially in the bile duct. Some medications can also cause this. See a doctor, ask a doctor. You can even call a pharmacist if you take a lot of medications to look for any kind of side effects that you may have. And of course, blood-stained or red. So blood-stained stool could be a symptom of cancer as well. Always see a doctor right away if you find blood in your stool. If you're finding bright red blood in your stool, that could also be indicative of something like a hemorrhoid or a fissure over by the anus. That is almost like a little bit of a tear that can occur down in the lower GI tract or down by the rectum. If someone has hemorrhoids, you can end up having blood in the stool, active bleeding. If someone is forcing stool and forcing defecation or the actual moving of the bowels, you could actually be straining to the point where you are causing irritation, and a hard stool can actually cause a little bit of like a little sore, a little tear, and you can see blood from that. So now the different types of formations of stool. You see over here the Bristol stool chart. You didn't really, I bet you're probably kind of surprised that there's an actual stool chart about the types of stool, okay? There's actually 7 classic types of bowel movements. Type 1, you have separate hard lumps, severe constipation, okay? So you can see that you almost have like little rabbit pellet poop over there, and that's like really tiny, and they're hard to push out, and they're little lumps, and they only come out little bits. So that is like from severe constipation. Type 2 stool is lumpy and sausage-like, could be mild constipation. Maybe they're like bigger nuggets, bigger little miggles and stuff, but they're not as small as the type 1. And then type 3, a sausage shape with cracks in the surface. That's a nice stool right there, okay? That's what would be considered a normal stool, and that person is passing that stool regularly and without difficulty. And type 4, like a smooth, soft sausage or a snake, but that also is normal as well. Some people, they poop harder, some people poop softer, but you can have a couple of different types that actually look to be like a normal passed stool. Type 5, soft blobs with clear-cut edges. Now that would be a lack of fiber in the diet. Fiber actually holds your stool together nicely, as you can see in type 3 and type 4. Type 5, it just kind of is lacking anything that's good that can actually help to produce a formed stool, okay? Type 6 over there, you see mushy consistency. It says ragged edges, mild diarrhea. It's like ploppy stools. Not quite watery diarrhea, but nonetheless, that wouldn't really be normal to pass that. Your intestines are not reabsorbing a lot of the fluids back into the body, and you're passing these mushy blobs, and these are actually like expelled from the rectum rather quickly in like a ploppy fashion, because it's on the verge of becoming like a severe diarrhea. Now, number 7, you see liquid consistency, no solid formation in it. You may see little streaks of food, little remnants of things, but mostly this is watery. It shoots out almost like you're urinating. This is severe diarrhea, and as you know, you have to be really careful with this, because if you're shooting out of water from your back end, you're also depleting your body of fluids that are necessary for homeostasis. We've talked about homeostasis with every body system we've covered in anatomy, how important it is to maintain a balance. Your bowel, your intestines, do a job in reabsorbing different nutrients, different vitamins, things that are vital for survival, to feed our bodies, to feed our cells, and to be able to supply food for our brains, food for every function in our body. If we are expelling liquid, we are also expelling electrolytes. If you expel electrolytes, you could end up with cardiac arrhythmias. That would be irregular heartbeats, and also that could be very life-threatening. So that is why if someone has diarrhea and it's persistent for a few days and they're actually getting dehydrated, you'd want to seek medical attention with that, okay? The next one, we're going to be talking about your dietary intake. and how important it is for bowel health and how it can actually improve your overall health. When you're constipated and you're holding back stool, that actually is not allowing you to eliminate the toxins and the waste and the garbage that builds up in your body. So if someone doesn't regularly move their bowels, and when I talk about regularly, some people go daily, some people go twice a day, 3 times a day, other people don't go except maybe every other day. But if you are an every other day bowel eliminator, you want to make sure that you don't go longer than 3 days, because 3 days is not really good, okay? 3 days can upset the body systems, and you'd want to make sure that there was some type of a dietary change, or maybe somebody would need a stool softener or a medication to help move them along, fiber pills, whatever it may be. But for stool health and bowel health and overall body health, because let's all admit it, if you're constipated, you don't feel real well. But if you're pooping every day, you feel pretty darn good, okay? Your appetite's increased, everything. Your overall general attitude is improved. So in order to keep and maintain healthy bowels, you want to make sure that you have nice fiber intake in your diet. There are soluble fibers, insoluble fibers, okay? These different types of food actually stabilize your blood sugar. They can lower your cholesterol, the bad cholesterol, and they can prevent constipation and reduce colon cancer risks, okay? All different healthy foods that help you poop over here. You have lots of fruits up there, sweet potatoes, different types of beans, legumes, rhubarb, lentils, fruit, veggies, nuts, artichokes, kiwis are up there. Stool softening foods that are easy for kids to eat. You can actually have little finger foods going on there. You can see little pieces of apple cut up, little nuts, dried fruits, that's very helpful, fresh fruits, whatever is there that kids will just eat and grab and they can eat on the run. Also, things that can really cause upset in the GI tract could also be allergens. If somebody has a lactose intolerance or they have a gluten intolerance, that can cause issues in your GI tract, and you would have to be tested for such allergies and possibly eliminate those items from your diet. And then last of all, but very important as well, is going to be your intake of fluids, okay? You can see the people on the left that are drinking a nice glass of what looks like lemonade. Water is always good as well, and I know a lot of people complain about water. I do too. And you can see the mason jars with the straws in there, very nice and bright and colorful. They actually did like a fruit infused water, and you can cut up fresh fruits, fresh vegetables, and it'll add a little flavor to your water, and that will make it more palatable for you. But yes, you should be drinking like, you know, they say like a decent amount. If you think of it, drink, take a sip. Always carry maybe a water bottle with you, okay? If you are caring for patients in the hospital and you're going in to answer a call bell, you see their water cup sitting there with a straw in it, and you say to them, oh, hi, can I help you? Here, take a sip of water. Water is always good. Increasing fluids is always good, and it improves your overall health. Okay, and that is it for today, and that's the end.